Hi, my name is Dr. Elam. Everything I do to challenge the status quo. I believe in approaching life differently. The way I challenge the status quo is by creating environments in my life to enrich original thought, creativity, and abundance. I just happen to be a dentist. The questions that I'm answering for you today are from your comments from Instagram, TikTok, and YouTube, in addition to the patients that I see every day. So keep asking them. I could talk about dentistry all day.
Dr. Elam, besides pain, why else is it bad to have a tooth infection?
Well, obviously, if you're in pain, the infection is not bearable. But let's say the pain goes away. That doesn't necessarily mean that the infection went away. Something that can occur from you not taking care of that infection is called bacteriemia. Bacteriemia is basically a blood poisoning that can occur from the bacteria from the infection in your mouth. Now, while it may not sound terrible, I know you guys all remember Michael Williams, former NFL player who recently died last year because of an uncared infection in the mouth. See, he had an infection and the pain went away and it spread to his systems and it basically deteriorated his systems and he died. And so while it's important to take care of the pain when it occurs, it's even more important to see if the infection is still there. If you do have pain and it does go away, still go to the dental office. You're going to want to get x-rays and you're going to want to get diagnosed from your dentist. That way they can tell you how bad the infection is, if you need to have the tooth extracted, if you can keep the tooth, or even if you just need maybe even a simple root canal to just remove the bacteria and the infection from the tooth. So there are a myriad of ways for you to attack it. And if you do get put on antibiotics, just remember, antibiotics don't kill the infection. They actually only do what's called arresting the infection. It stops it from proliferating. A lot of times people will take antibiotics and because the pain went away, they think the infection went away. So just because you're taking antibiotics doesn't mean the infection goes away. So you still need to follow up with your dentist to see how bad the infection is.
Why is it important to get your wizzies out?
Well, first off, for those of you guys who don't know what wizzies are, those are just wisdom teeth. And if you've had your wisdom teeth, you know that they can be painful. They can be impacted. They can be erupting. They can be inside of the bone in your mouth. So every case is different. But for those of you who are wondering if you should get your wisdom teeth out, talk to your dentist because everyone does have a different opinion on when you should get your wisdom teeth out. But if you're in pain and your wisdom teeth are causing obstruction to the adjacent teeth, more than likely you need to get your wisdom teeth out. Now there's a difference between the wisdom teeth on the top and the wisdom teeth on the bottom. The wisdom teeth on the top are usually less sensitive than the wisdom teeth on the bottom. Why is that? Well, you see, there's a nerve that runs all the way through the bottom of our jaw and intersects here at the tip of our chin. And so any pressure that the bottom wisdom teeth are going to be putting on this nerve, you're going to be able to feel it. And it's going to feel like a big headache. The top teeth won't affect it in that way. So if the teeth are inside the bone and they're putting pressure on that nerve, more than likely you're going to want to get them out. In addition, let's say the wisdom teeth are just kind of erupting. They're kind of poking their little head out. Well, it's tough to get back there and floss and clean, even with the proper instruments. So in that case, if it's causing unnecessary decay, unnecessary bacteria, maybe there's a little smell in the mouth because food got caught in there and you can't get it, then it could also be an option to look into to get your wisdom teeth taken out. But ultimately, if you're not in pain and you're able to chew fine, you're able to eat fine, you're able to talk fine, then you really don't need to get them out. But I like to think of wisdom teeth like our tailbone. We don't really need them, even though evolutionarily we still have them. So talk to your dentist, get a second opinion, and then make the decision for yourself if it's a procedure you want to go through. So thank you guys. I hope this video helped bring a little bit more understanding to the dental world, to the dental field. Hopefully it empowered you to have a little bit more confidence and reduced anxiety the next time you step in the dental office. But please keep the questions coming. Keep the questions coming. Slide in my DMs, comment on all my posts. I will answer your questions. Thank you so much for inquiring. And please stay flossing and keep smiling.